Thank you, Olivia, and welcome again, everyone. And feel free to throw in the chat kind of where you're coming from so we can welcome you all individually too. So thank you again. I think we just saw you a few weeks ago. So just a quick turnaround office hours. Last month we had our conference, so that kind of impeded on our regularly scheduled office hours. So we welcome again. And we're going to be looking at are you getting the most out of what Apexus has to offer? As always with our office hours, they're supported with federal funds. So we're prohibited from discussing anything related to advocacy in this forum. Next slide, please. All right, pretty short agenda. Obviously, just welcome you all again. We're going to have my colleague Vicharia Tutson provide a regulatory affairs update. Won't have a state affairs update this session, but we'll look forward to that in the next month's office hours. And today, as noted earlier, our speaker for today is Michelle Fox. She's a manager of the 340B Education and Compliance Support with Apexus. It's a HRSA-funded organization. So she'll provide an overview of the Apexus website and some additional resources that are available to you. And then we'll have a little short session with some Q&A. And just for the Q&A, we did get pre-submitted questions, and I'll try to make sure we address those on the front end if we can. And if not, we'll hold those and possibly draft a little FAQ that we can get out to everyone with those questions. All right, moving on to our next slide. All right, I'm going to hand things over to my colleague, Vicharia. She's our Director of Regulatory Affairs. Vicharia.
Thanks, Brandon. Hey, everybody. I was going to say happy Monday. I don't even know what day it is. Happy Thursday, almost Friday. I'm sure I'm not the only one waiting for Friday. So holler if you hear me. So I'm going to give an update on all the litigation that has been going on the last few weeks. We have gotten a lot of judgments out of the court cases. And so I just kind of want to break it down and let you guys know where we stand. One thing I will say, just to caveat all of this, is that none of the judgments were clear and broad. You have to kind of look at all the issues on a micro level to kind of understand, where we are and what does this mean moving forward. And I will say that that's probably a good thing because, worst case scenario would have been one of these judgments saying, the 340B statute does not include contract pharmacies. And so none of the judgments went that far. And I think a lot of them, or I would say, the Sanofi case, and definitely Sanofi and Novo Nordisk was decided under one judge. And then Eli Lilly, those two cases, I think, were really in our favor and really set great precedent moving forward. And so in the last few weeks, there has been the Eli Lilly judgment, the Sanofi and Novo Nordisk, and then also Novartis and United Therapeutics. And so the Eli Lilly case and the Sanofi and Novo Nordisk case talked about the, or addressed/challenged the ADR rule, the December advisory opinion, December 2020 advisory opinion, and then as well as the May 17th violation letters. The Novartis and United Therapeutics decision only addressed the May 17th letters. And so that's just important also for context. And so even though the Novartis and United Therapeutics cases don't really apply to FQHCs, it's just important to understand for the context of how will HRSA move forward with interpreting the 340B statute in regards to contract pharmacies. So it doesn't squarely fit under our lane, but these are things that we're watching because, if HRSA has to issue a new interpretation or new guidance, that will still include health centers and will also include how, the 340B statute or any guidance coming out will be altered. So first, I will start with the May 17th letters because I think that's really important. As we know, where it stands now, May 17th, 2020, HRSA issued 6 violation letters to manufacturers telling them that they need to resume shipping to contract pharmacies, that they were in violation of the 340B statute. And if they did not resume shipping to contract pharmacies, that the agency, HRSA, would move forward in referring the manufacturers for civil monetary penalties to the OIG, the Office of Inspector General. Months later, HRSA did move forward and refer those manufacturers to the OIG for civil monetary penalties, and that's currently being under review. And so the OIG has a discretion if he would like to levy those civil monetary penalties against the manufacturers. I'm sure all the timing of everything is playing out of there's the court case, there's the ADR process. So it'll be interesting to see just how the government aligns their timing with all these different pots on the stove that they have. So in both the Eli Lilly case and the Sanofi and Novo Nordisk case, the judges both invalidated and vacated the May 17th letters. However, they invalidated them because they felt that HRSA did not clearly state why they have changed their position, and also what is the agency's position on contract pharmacies. And so it was vacated and remanded back to the agency, which means that they pretty much sent the letters back to HRSA saying that, hey, these were maybe issued a little premature and you need to really think through where contract pharmacies align in the 340B statute. However, both court decisions did state that the manufacturers and their new policy proposals to refuse to ship drugs to contract pharmacies was in violation of the 340B statute. Both court decisions stated that if the 340B program flowed the way that manufacturers wanted to, that would actually restrict access, and it would be contradictory to the intent of the 340B program, which is to help safety net providers serve underserved communities with resources that we know they don't have. Both court cases mentioned how when the 340B program started, less than 10% of the covered entities had in-house pharmacies. So there was no way that Congress did not intend for contract pharmacies to be using the 340B program when majority of the safety net providers in the program did not have an in-house pharmacy. And so why this is a good thing is because even though the May 17th violation letters might not stand, having the court reinforce our position of saying that, yes, maybe the question is still out on how many contract pharmacies a covered entity could have, but it has been concretely decided by two courts that Eli Lilly and Sanofi and Novo Nordisk interpretation of the 340B statute is wrong, and that Congress intended for this program to have a broad effect. So moving forward, HRSA has the ball is really in HRSA's court of how they would like to move forward. I'm sure that HRSA is waiting before they issue new violation letters to get the rest of the judgments out. We know that the Eli Lilly case still has a determination out on the ADR rule. So I think we won't see a new violation letter or new steps from HRSA until they probably have the full scope of the legal judgments and how to move forward. However, I will say that we as health centers and covered entities are in a very good position because the courts have outspokenly said that, yes, this is the interpretation needs to include contract pharmacies, at least one. And so that's a step in the right direction. And I think also with the May 17th letters, something that, all three court cases kind of mentioned is that Congress really needs to step in. And we know that Congress won't step in until the litigation's resolved, but it's a very interesting dynamic that, the courts are saying Congress needs to get involved, and Congress says they want to get involved, but they don't want to get involved while there's litigation. So it's also very interesting, and that's something that, we are monitoring as well, but, to say that we're in a good place when it comes to interpretation of the pharmaceutical manufacturers and their actions, taking it a step too far and would restrict access under the 340B program was not the intent of Congress, and that the government's position is more in line with what the courts interpret 340B to mean. Second, another big position that I think is important to mention is that, the courts really focus on that manufacturers, the reason they're violating or could be violating the 340B statute is because they're taking unilateral actions on their own and imposing conditions on covered entities. And so what that means is just simply that, Eli Lilly, Sanofi, Novo Nordisk kind of woke up one day and decided not to ship drugs to contract pharmacies. And that, under the court's purview, is illegal, and that is not the interpretation of the 340B statute. So that also really supports our position, and it really supports us moving forward. I will say that the Novartis and United Therapeutics decision was not as friendly to us as covered entities. I will say that, that decision does not squarely fit under us. However, now we're kind of in a more muddy situation with the Novartis and United Therapeutics decision of Eli Lilly and Sanofi very clearly are in our favor for the majority of the part, but Novo Nordisk and United Therapeutics could be seen more friendly to the pharmaceutical manufacturers. So that is why I think HRSA is probably going to wait for either more judgments or just to kind of get their ducks in a row, because if HRSA issues any more guidance, they really need to come as correct as possible, because they probably will only have one more shot before pharmaceutical manufacturers really take that and run with it and just, completely violate and have no regard for the 340B statute. Now, what does this mean for the ADR process? The Sanofi case is the only one right now that has a judgment on the ADR process. We are still waiting for the Eli Lilly court to issue their opinion on the ADR process, as well as the pharma, the actual trade association, pharma, their lawsuit as well to issue a decision. However, the Sanofi case upheld the ADR rule and also stated very clearly that our claim of saying that health centers have been overcharged because the 340B price is not available is a correct interpretation and definition under the ADR rule. So Sanofi challenged, saying that technically not making the 340B price is not an overcharge under the statute, and that HRSA was in violation of, their statutory authority. And so because the court sided with us saying that this is an overcharge, that really helps us move forward in our ADR process, because that is what all of our 225 claims against Sanofi, Eli Lilly, and AstraZeneca claim, is that health centers have been overcharged because the 340B price has not been available to their contract pharmacies. So moving forward, that is a great thing for us with our ADR petition. We will not see any progress with our ADR petition until December 16th. And that is because Sanofi and AstraZeneca have asked the ADR panel for a 30-day extension. So they were supposed to respond to our original motion by Monday. And so they, of course, have asked for an extension, which was expected due to all the litigation. However, we are really hoping that the Eli Lilly court also follows the Sanofi precedent and upholds the ADR rule. So we will be monitoring that closely. The Novartis and United Therapeutics case does not touch on the ADR rule. So that has nothing to do with our ADR process. So where we are now is still monitoring for the litigation. We will still be engaging in our ADR process and awaiting for December. So it'll be very interesting to see Sanofi's response to our ADR petition, as well as Eli Lilly by middle of December, because of the litigation results. So I think NAC is in a very good position. I think health centers are in a very good position. We're just really in a wait and see mode. So I know that you all have been very patient to see how this turns out, but it's also a great thing that the courts have said that the statute is interpreted to include at least one contract pharmacy, because that means we're not going to have to start from ground zero. So I'm encouraged. It's an uphill battle, but we're almost there to getting to the top. So please feel free to reach out to me if you have any more questions, if you would like to chat anymore. If there's anything else maybe I missed, please let me know. And I'll turn it over back to you, Brandon.
Thank you, Cherry. And I was watching some of the questions, and I know you may need to hop off, but I don't want to catch you before you go. Oh, okay.
Yeah.
Okay, perfect. I did want to post this question while I got you, and then we'll head on to our presentation.
Okay.
Derek just mentioned, I can't believe we're going to say this, but isn't our best option at this point congressional action? That's the question. All of this court business just going to go on for years.
So I think, yes, that would be our best option. And if Congress actually just explicitly interpret it. However, what I will say is that the Sanofi case, they actually believe that Congress has been clear on the contract pharmacy issue. So there is the legislative history that supports that Congress knew about contract pharmacies when they drafted the statute, even when they expanded in 2010. So I think we would love to have Congress intervene, but I do want to caution people that pharma has a lot of money. Pharma has a lot of lobbyists. And even though Congress might be on our side, pharma could muscle us on the hill. And so if it gets down to us having to do anything at Congress, that really would take us as a health center community really powering up. So even though we all feel that a congressional fix would be helpful. I think the court judgments and what is the interpretation of the law is our best bet right now. And that's like a not worst case scenario, but maybe like a break the glass type of scenario.
Great. Thank you, Vacheria. All right. And there's one other question about hold that one, and any other questions that you may have, even for Vacheria, feel free to plug those into the Q&A. We'll try to make sure we get those answered along the way. But I see the other one in there. I'll hold that one for Michelle once we wrap up. All right, so we're going to move to our next portion of today's session. Michelle Fox, she's the manager at Apexus, and let me get your title correct in 1 second, Michelle. Michelle with Apexus, she's our okie dokie. Of course, I'm losing all my slides. Great. Michelle Fox, I presented you earlier. She's the manager of 340B in compliance with Apexus, HRSA-funded organization that works very closely with us and certainly with her. So there it goes. There it goes. Thank you, Olivia. I'm not going to waste any more time. I'm going to hand things over to Michelle. And again, as I mentioned in the chat, if you have any questions specific for Michelle, plug those into Q&A. I'll be monitoring that as we go, as well as the chat. And we'll try to spend a good 10 minutes or so at the tail end to answer any of those relevant questions. All right, Michelle, go ahead.
Thanks, Brandon. I appreciate it. Let me share. Okay, so can you confirm you're seeing the Apexus website?
Yes.
Okay, good. All right. So thank you for having me here today. I really appreciate it. I'm glad to be here. We're going to be going over the 340B PVP website today. So some of you may be newer to the 340B program, and some of you may have a number of years of experience. But our goal today is just to give you a few actionable items, some things that you may not have seen before, and make you aware of some of the updates. Our website as well as our educational materials are constantly being updated. And so hopefully I can highlight some of those things that are new to you and that you find value in. So today, like I said, we're going to go over really the PVP offerings on the website, but not really talking about content within those or policies. So just wanted to clarify that up front. And then just really let you know that as the PVP, we work with all stakeholders to bring value and transparency to the marketplace, and we try to provide tools and resources to help all stakeholders implement some compliant programs. And as the prime vendor, we really do strive to collaborate with our partners and make sure that we are providing the tools that are really relevant to helping you maintain a compliant program. So I'll be highlighting some of those today. But as always, if you have tools or gaps that you're looking for, we really do want to hear from you. So I'd be happy if you dropped some things in the chat that were possibly some tools that that we don't have that you would like to see. Okay, so here we're going to start. This is the 340bpvp.com website. It is our main landing page. This website, like I said, provides resources for all stakeholders in the program, with the PVP being a neutral player. So you'll see at the top in the menu, there are tabs for all different stakeholder types, covered entities, manufacturers, distribution. Obviously today we're focusing on some FQHC and community health center folks. So I'll hone my program into discussing those tools and things that are most interesting to you. But as covered entities, being a participant in the 340B program does not also equal participation in the PVP program. So there is those are separate processes. So if you have questions about that, we can address that. But we're going to talk about the public-facing resources that are free to everybody. And I will mention a few things that are available only specific to the PVP members, in case you are already a member and are unaware of those resources. But those generally are, they include some covered entity specific data. So that's obviously secured behind logins and passwords. So I'm going to start here under the 340B University tab, just a general navigation in our website. If you hover over any of the menu items at the top, it's going to show you a drop-down menu of what you can find below it. So we're going to start today by clicking on the 340B University tab in the menu. And this is going to bring us to the main page. And what you'll see here at the bottom, peeking out, is the education library. So this is a new addition to the website. The education library was developed to help bring all of the different resources and offerings all into one place at your fingertips. So the library allows you to select a couple different ways. You can keyword search, like you're probably familiar with Google and other searches from the internet, but you can also do stakeholder type specific. And so here I could select community health centers. This allows you to multi-select if there's more than one thing that you want to, but you'll see that once I click the stakeholder type, a second option drops down. So experience level, you can choose what experience level you're wanting to identify items for. And then the lastly would be the delivery mode. And you can click all the way through if you want it to be more broad in your search. But here you can see whatever I choose in this, and they're just toggles on and off, is going to refine the tiles that are shown down below. So you can see there's a lot of different resources being shown here. So with all delivery modes, you can see that we're seeing in-person events. The University 340B Winter Coalition is coming up. If you click on these, this is going to take you directly to the site where you can register for this. And if these were downloadable tools, it's going to automatically download that tool for you. So this is the all-in-one place that helps you identify tools without having to know maybe where they live specifically. So this also includes on-demand and any other self-paced online learning. So that's the library. You can remove all filters and start over if you don't really like where you landed, but it's really easy, user-friendly. And I cannot show you from my screen because I don't have the privilege, but when you're working in the library, you will get a pop-up at the bottom for a survey. So that survey is going to ask you just to rate your experience with the library. And it's also going to ask for feedback. So this is an opportunity that while you're in the library to provide some specific feedback on the fly. We wanted to make it really easy for you guys to be able to provide any feedback that you wanted along the way. So like I said, I already took the survey once, and so it goes away for me, but it's an option that you should see when you're navigating through this website. So then the next are the HRSA FAQs. So I think a lot of you are familiar with those. On the Apexus PVP website, we have the FAQs categorized into different areas, but you also can keyword search as well. So you can see if I put in a particular word, it's going to pull up FAQs that may contain that or be relevant. So this helps you identify specific areas that you may be searching for some FAQ support to understand the program better. So the next I'm going to talk about the Resource Center. This is where we house a lot of our download tools, all of our tools actually, calendars of events, and other updates about 340B University, and then our Medicaid resource. So I'm going to start really by walking through the tools section and help you navigate that and understand. I'm also going to highlight a few of the tools while I'm here. So when you go to the 340B Tools website, under this Resource Center tab, you'll see that there are 4 different categories of tools. So this is just to help each of the covered entity types understand what tools are most relevant to them. Oftentimes our tools are covered entity specific, and so this is where you'll go to find the most refined list of tools applicable to your health center. So as I click the plus and it expands, you'll see that there are a lot of different tools out here. So we've broken them down into particular areas. So oversight, policy and procedure manuals, registration, and then under the auditing compliance, there are entity-specific tools. There are some HRSA-specific tools, and then operational purchasing, and then just some general acronym guides and glossary of terms. So the most commonly used tools are the self-audit tools that are developed specifically for the CHCs, as well as one of our newer tools, which is the Community Health Center's Getting Started in 340B checklist. So I'm going to actually walk through the Getting Started in 340B checklist just to give you a little snapshot of what's available. So this tool was designed to help new entrants into the program understand all of the different tasks that were necessary in setting up a compliant 340B program. So this tool has categories here on the left. So it's organized by the type of task. There's compliance related tasks, there are education and training related tasks, and there are purchasing optimization tasks. And the way that the tool works is there's the category, there's the task that is specifically to be accomplished. And then there is a section that is a how-to or a resource that kind of gives you the why behind why you need to do this and how you need to accomplish it. And then links to accomplish these tasks are listed over in column D. You'll also see here that the tools are identified based on when they need to be accomplished. So they're broken down by prior to registration, prior to going live, within the first 3 months, within the first 3 years, or within the first year, and then ongoing. And so this helps new entrants to the program, or even folks that have been in the program a while, make sure that they've accomplished all of these things. But since there is a lot in this, there's a lot to do when you open up a new 340B program, we felt it would be helpful to give them in a particular order and identify kind of the time frame for understanding of urgency. And then the other part is that it's got a section it like a project management tool. So this allows pharmacy managers or directors to help assign these tasks to other staff to help accomplish this. And so we created a space in here for you to assign it and track who's done what and when that gets completed. So like I said, this could be for those new to the program, but also a good checklist for someone who may have been in the program for a while and wants to make sure that they actually have accomplished all of these things. I know it would have been really valuable to me inheriting a program as opposed to building it. So I'm going to go back here to the website under the resources. So another one of the newer tools that was developed in the last year or so is the Medicaid exclusion file checklist. So I'm going to highlight that quickly. So the Medicaid exclusion file checklist is a list that was developed to identify some of the common errors that are seen, to educate on why this is an error and what needs to be done correctly, and then ultimately, how do you fix it? How do we, if I've identified something's wrong, what do I do to fix it as soon as possible? And so this tool is broken up into some general areas, general common errors. You can see typos, incorrect or transposed NPIs, or the wrong NPI type, or omitting the MPN if that's required for billing in your state, or inconsistent listings that don't match what you're billing. That's one of the most common errors. And then it also goes from some of these general errors into errors that are for covered entities with retail pharmacies. So there's a couple that are are just specific to the retail pharmacy practice setting. And folks may look at those sites a little differently since pharmacies are not actual registered sites. And then there's the last section is for covered entities with different billing practices at child sites. So often this is in hospitals or associated sites for health centers. So if you haven't taken a look at this, this is a good checklist to go through and see what other common errors have occurred, why this is an issue, and then how, if this happens at your location, how you can quickly resolve that. So I also want to note that when you're looking at tools, our tools are they vary in document type. So we have some PDFs, we have some Word documents, we have some Excel documents. It really just depends on what was the best use for that tool. Your browser may handle these differently. So PDFs, as you saw, the PDF actually opened up right away. The Excel documents and the Word documents, if you click the link, they download. And in the way my browser is set up, they could just kind of download secretly over here. And so if you don't see something happening and you think it should, go check your downloads, because oftentimes that's where I'll find 3 or 4 downloads of the same document because it wasn't acting the way I thought it would. So I just want to give you that heads up. The majority of the tools are probably going to come through a download because they are tools that are expected to be interacted with and updated. So they are oftentimes in a Word document type. So you can see in the oversight section there are quite a few other tools that help covered entities identify whether they have all areas of the program covered. There are some C-suite guides to the 340B program. But I want to jump to one of the auditing and compliance tools for the covered entity. So this is the self-audit policy and procedure.
Hey, Michelle, if I can interrupt you right quick. There's a question from Lana. She said, hi, Michelle, for an entity-owned pharmacy, does the shipping address have to be listed under all of the associated sites as well as the main site?
Can we address that at the end?
Sure.
Okay.
We'll hold that one.
Sure, thanks. Okay, so for the self-audit policy and procedure, this tool really is to evaluate whether all of your policies for all different aspects of the program are included in your policies and procedures template. And so this particular policy and procedure goes through different assessment questions to make sure that areas that you should have oversight over have been addressed in your policies and procedures, and that you are accounting for that. So this is a really good tool to help make sure you've covered all the important areas. And then that one leads me to another tool that's been recently updated and is frequently updated, is the sample HRSA 340B audit data request for covered entities. So this one's a PDF, so it opened right up. Hopefully you guys can see this. This tool does a great job of walking you through what is expected when you are actually going to be audited by HRSA in an actual 340B audit. So note, this is just a sample, but it is frequently updated, and it helps identify all of the areas that you need to provide policies and procedures on. And so you can see there's about 14 different areas that need to be addressed. And so this really can act as a checklist for you to walk through and look at each of these items and then determine how you've addressed those in your policies and procedures. And then the second section is the documentation that you need to provide. So this includes sections for hospitals. It also has sections for grantees. And so this lists out what you need to actually provide in documentation. So it helps you understand and make sure that you can be sure that you could provide this documentation in that window when that letter comes and you're asked for it, because it's generally a 6-week turnaround, but there's a lot to be thought about in an audit, and so you want to make sure that you've taken a look at this and that you have some confidence that you could provide all of these things really at a moment's notice. And so you'll see there's a special section just for grantees, identifying what documentation will need to be provided and uploaded. And then it talks about the 340B universe for the sample period, being able to provide the data that includes all of the elements that are listed here. And then provider lists, purchasing documentation, contract pharmacy documentation, and then any self-disclosures. So it's a pretty extensive document that I recommend you take a look at. And hopefully you can be able to check off all of the boxes within this area. Okay. So one of the other things that I want to highlight is under the Resource Center is Medicaid. So we have a Medicaid resource that helps identify source information that we've been able to provide and try to connect users to. So this has been updated. It was updated and soft launched in October. So if you haven't been here in a while, you'll notice this looks a little bit different. But I'll walk you through briefly just to give you the update of what's been changed. So again, you still go and choose a particular state that you're looking for. And what you'll see always at the top is help improve this site. So this is really a group effort. The PVP is really prohibited from making interpretations. So our job in this is to help connect you to information that we can source as being valid. And so in some cases where you don't see information, it's because we could not provide or validate the source. So if you have a way to help us with that, here's the link where you can do that. We really appreciate that. So it helps us continue to improve this site and this resource. So the second thing you see is the Medicaid contact details. And so you'll see there's 3 contacts. There's a technical contact, a rebate contact, and a policy contact. This is to help you when the information here might not be adequate or you have a specific question, you can reach out to any one of those 3 contacts. So down here, we've kind of condensed some of the information, but this is the state Medicaid details. You'll see that it has the retail pharmacy transaction. It's for fee for service. It has the provider or facility administration transactions, and then a section for contract pharmacies, and then a section for Medicaid managed care organizations, or the MCO information. And so you'll see here, it's similar information. It's just condensed a little differently. It helps you understand some of the requirements around each of these different practice settings. And you can see that these source links take you back to the source information. So I'm going to jump down to the MCO area where you can see where we've identified if a state uses MCO plans. If we're able to identify what those plans are, we can list them here. Sometimes we do or don't know the PBMs. When the information is available, it's because we could source it and we have a link to it. And in some rare situations, states will publish actual BIN and PCN group numbers. So this is one example where that's possible. But you notice we didn't list the BIN and PCNs on our actual website. We take you to the Pennsylvania Department of Human services site where they post it, because this information could change, and if we put it on our website, we would run the risk of it being inaccurate if changes were made here. So we're providing the source links to help get you to this information from the proper sources. And then on every page of our website, you'll see that there's a live chat box. This live chat takes you directly to Apexus Answers. And from our Apexus Answers tab, you'll see there's actually 3 ways that you can contact Apexus Answers. So you can just send an email with your question. It goes to the Apexus Answers call center, and they assist with your question and respond with an email reply. You can do the instant chat, where you can either chat about what's on the website or actually just open a general chat to ask questions about a concern or a question that you have where you didn't already find the resources here. You can also call the call center. So 3 different ways to connect, to talk to the Apexus Answers call center agents that can help you with all things 340B. So Brandon, that really concludes the majority. Actually, I will take you one other place. In-person training. I want to highlight that we do have upcoming events specifically for the 340B University. So we'll be in San Diego on Sunday, January 30th. I mentioned it earlier from the education library, but really specifically, and then our event calendar which is under the Resource Center, has all upcoming events. And so in-person, virtual, or other training opportunities are all listed here.
Great. Thank you, Michelle. Before I get to the actual Q&A, there was a question, and Buffy, I'm not sure, and feel free to unmute if you like. You're saying how often is that updated? Do you know? I'm not sure what she's referring to. Feel free to clarify, Buffy. And you can post that in chat if you'd like, Buffy. And while she's doing that, I will get to, there's only 2 questions, and I think I posed one earlier. But before I get to that one, if you know the answer to this, Michelle, do you know like when the next 340B research for FQHCs is due? Because I know there were some changes around the deadlines because of COVID, I believe. I
actually do not know those dates off the top of my head. Especially since they've changed. Yeah, I apologize.
Yeah, no worries. There's several of the questions I already had that were pre-sent to us. I'm going to have Tim provide some answers to that, and we'll get like a little short FAQ back out to everyone. Tim had to step away for a personal matter, but I'll make sure he addresses those. We'll get those back to everyone who's registered. Now, the other question I asked you before was about the entity-owned pharmacy. Does the shipping address have to be listed under all of the associated sites as well as the main site?
My question really is this around establishing just a shipping address for an account, or is this related to the Medicaid exclusion file? I want to clarify, because I feel like they're based on what I talked about in the Medicaid exclusion file checklist. That question might have been related to the Medicaid exclusion file, and that's really less about shipping address, and that's more about rostering the proper NPIs.
Right. Oh yeah, Luana.
Okay, so yes, yeah. Okay, so what you're asking then is really not about the shipping address. It's about whether you should roster your NPI and MPN under all sites. So the answer is, for transparency, you should be rostering your entity-owned retail pharmacy billing information with any associated site that you could fill a prescription from.
Great. Hopefully that answered your question, Luana. I see she did. Understood. Thank you so much. Great. Thank you, Luana. Buffy, just to clarify her question earlier from the chat about how often is it updated? She's referring to the Medicaid side. Is how often is it updated, or is it state by state, if you're aware?
Oh, the Medicaid resource site.
Mm-hmm.
So we do quality assurance every 6 months. So twice a year we go out and our team approaches that. We go out and look and check and make sure the links are still good, the site's still good. However, if someone provides us with some new information, we'll update that as soon as possible. But at a minimum, it would be about twice a year. In some cases, though, like you'll see on that page, there's a date of when it was last updated. Sometimes there is no additional information, or the information that we have that we could source is still old. So take a look at the date that's on that page. That's an important piece of information to look at, because that was when it was last updated.
Great. There are no additional questions. I see someone just made a comment just about you being a great resource. So thank you for everything that you do, Michelle.
My pleasure.
An additional one saying that the university site, this has helped them with the university site being able to navigate that. So that was helpful. All right. Got a couple more minutes for any additional questions from everyone. And while you're thinking of questions in the chat, I did post, feel free to add and elaborate, Michelle, but I did post a comment about those folks who are interested in the Apexus Advanced 340B Operations Certificate. NAC members are, if you're an organization member, you do get a $100 discount off that program fee. So just FYI, I put the link in there for the user guide that has all the information in there. So feel free to take a look at that. And I believe we do have that posted on our NAC website as well. So that's just a FYI if there's any pharmacy leaders online that would be interested in that Advanced 340B Ops certificate. All right. All right, hearing no additional questions, you see my and Tim's email. Hopefully everyone has it by now. Feel free to shoot us any questions or topic ideas that you have. I'm sure many of these folks may be on the line, but I've developed a short list of some potential steering committee members. So if you also have interest in being a pharmacy officer, our steering committee, feel free to shoot me or Tim an email. And certainly if you have any interest in or need someone to be added to the novel pod, also send Tim and I an email, as you all have been doing already. But particularly for the steering committee, I plan to send out an invite email probably within the week, a little after, maybe after Thanksgiving, to invite those folks to having an initial conversation. And the purpose of the steering committee really would just be to kind of do a deep dive discussion into what are relevant topics, and for us to kind of help plan a little better for our office hours to make sure we're getting relevant hot topics for you and presenting those with relevant resources for all of our upcoming office hours. And as you've noticed, that all of our office hours now, you're able to register up through, I think, January is how Olivia has it set up now. We can extend that a little further too, as we secure more topics. All right, let me double check the Q&A before I wrap up. Okay, no more questions. We've addressed those and all good there. As a reminder, our Health Center Resource Clearinghouse is always available. All of our recordings are made available to that clearinghouse for everyone to access if you've not, if you were unable to attend the office hours, and if you have colleagues you'd want to see the recording, you can feel free to locate that in the Health Center Resource Clearinghouse. And once today's recording is available, Olivia will send out another notice with that information in there along with the eval. As well, always follow us on our social media platforms through Twitter, Facebook, Instagram, and LinkedIn. And of course, YouTube. I know our advocacy group pushes a lot of information out that way as well. So you'll be able to see any updates from us on any of those platforms. All right. Thank you all. I appreciate it. Michelle, again, thank you for a quick turnaround presentation. Seemed to be very helpful to all of our members. All right. Take care, everyone. Enjoy.
My pleasure. Bye.
Bye.